Hey, it's Teresa from Life Beyond Diabetes. And this week, we have been talking about my journey from diagnosis through um, the times of stress and shame and early diagnosis to a big period of not really knowing how to manage my disease and kind of just trying to bury my head in the sand and pretend it wasn't happening to the point where I learned the things that I could do to take control of my diabetes and have been taking control of my diabetes. And, I've learned a lot and I've taken control and doing a lot better with my health. I wouldn't say that I'm a master at taking care of it because this is a disease that is ongoing and I don't think, it's always unpredictable, but I've gotten there. I've mostly figured it out and can pretty much handle when new things come along. I backslide sometimes, just like we all do, but for the most part, I'm pretty good at handling when the things come along. But one of the things that comes up a lot when I'm talking to people is they'll say, "Well, that's all well and good, Teresa, but you're a medical provider. When you go in and ask for things of your nurse practitioner, she listens to you. I'm not a medical provider. Why are they going to listen to me?" And I have a couple answers to that. One is that I was a nursing student when I was first diagnosed. So, yeah, I was a nursing student. I was on my way to becoming a medical provider. And then I was a nurse, but I was in the medical profession, but I certainly wasn't a peer to the medical providers I was seeing. And now I'm going to tell you, I'm probably going to slip into talking about doctors, and I want to say that I'm not actually talking about doctors. I'm talking to any medical provider, that the prescriber, the one who's managing your diabetes. So that's, could be a physician, could be a nurse practitioner, a physician assistant. Sometimes it is registered nurses who are the diabetes educators or dietitians. Just in general, though, a lot of people just say, well, my doctor said this. So for the purposes of this video, if I say doctor, I'm not talking specifically about doctors. So I want to be really clear about that because I don't want to be doing any doctor bashing. And I don't want to say that physicians are the ones that have all the knowledge. So, whatever kind of provider you're seeing and whoever you're comfortable with, that's the right provider for you. So now that I've gotten that out of the way, so I get a lot of people telling me, it's all well and good that you've mentioned this different medication, and it sounds like it might be something that would work for me, but my doctor's never going to agree to prescribing me something just because I told him to or told her to. And um, I want to say, you know what, this is your disease, and this is about your health. So while it's really hard sometimes, this is one of the times where you need to really feel empowered to take charge of your health. And there's some right ways to do that, and there's some wrong ways to do that. And you know, one of the things that I talk about a lot in my practice, and one of the reasons that my patients keep coming back, is that we have a collaboration. We work together. We figure out, when I rarely say you need to take this medicine. This is the right medicine for you. Instead, I'll say, here's what I see happening. These are the medications that I think might work. What do you think of these? And, unless we're urgent on it, I'll say, if you want to, and I have some patients who I know like to go do their research, I'll say, you know what, here's the information on this drug and the information sheet on it. Why don't you go home, read up on it a little bit, and we'll talk about it at your next appointment. Because while I might be the expert in the medicine, they're the expert in their body, and they should be the one who's making the final decision. Similarly, you are the expert in your own body, and the decisions that are made in your doctor's office affect you and affect the rest of your life. So you need to feel empowered to be a collaborator in the decision making when you're in the room with your medical provider. So a few things about that I want to say. Some suggestions for how to do that. And the first one is to be respectful. Don't go in and say, and 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 when I say that, I don't mean be deferential. I don't mean to say you need to bow down to your nurse practitioner. But go, recognize that your doctor or physician assistant has spent years becoming educated in medicine. They know they've spent a lot of time learning what they're learning. And if you think about the things that you're an expert in, if somebody who even though they were experts in parts of it, the part that applied to them came in and started to tell them, well, this is the thing that you need to do, you probably wouldn't respond to that very well. You probably get all tense about it. And I'll tell you, when I have patients come in, even though I'm all about the collaboration, if I have a patient that comes in and right off the bat is just, this is what I need you to do for me, I immediately step back because it's threatening and it it really puts me on my guard. So it's really important to come at it with an attitude of collaboration and um, to respect the knowledge that your doctor has. So that's the first thing is respectful. The second thing when you're taking a request to your doctor is to make it easy for them to have the time to be collaborative. Because one of the reasons why the providers don't spend much time is because they're not given much time and they tend to be running behind all the time. So there's a few tips to kind of get a little bit more time than what you might get. And the first of those, and this is the thing that I do every single time, no matter what provider I'm seeing, and I book out as far as I need to do this, I get the first appointment of the day. So I know that when I see my doctor, she is not running late yet because she did not spend time going over with even just the one appointment before me. She's on time. So if she's not on time, it's her own fault and I don't feel bad because she didn't get there, she overslept or stopped for coffee when she shouldn't have. But that first appointment, they are running on time generally. Um, and so they're not already feeling like, oh my goodness, I'm already behind. I need to catch up. So that's one of the things. It's a strategy. And sometimes if you've got young kids, other responsibilities, it's hard to manage getting that early appointment. But particularly if you've got something that you really want to talk to your doctor about, make it happen. Get somebody to watch the kids or drop the kids off at school. This is not going to be happening all the time. This is on the rare occasion that you need to get that early doctor's appointment. Make it happen. It is not insurmountable. You can do that. Um, and along with that, with the timing, make sure that when you do have a question, one, you let the medical assistant, oh no, I'm sorry, before that, ask for, a lot of times when you call and make your appointment, or if you're doing it online, you can say, you know what, I have some questions and I'm afraid that this might go over the normal allotted time. Can you please schedule me for a longer appointment? So I happen to know that my physician that I see schedules 10-minute appointments. But when I ask and say, I have, this is my diabetes um, checkup. This is actually, I'm not seeing her anymore. I'm seeing an endocrinologist now. But when I was seeing my primary care physician, I would say, this is a diabetes checkup, and I have things that I want to talk about that are going to take longer than just the standard 10 minutes. May I have a 20-minute appointment? And they always made that happen. So she was never rushed when I specifically requested a longer appointment. Now, when I was just going in to see her for something like a sinus infection, I didn't ask for the longer appointment. That was something, boom, boom, I'm in and out. But when I needed more time, I asked for more time. So I didn't need to feel like I was taking more of the time, putting her further behind. And she also knew that she had the time to sit because she wasn't looking at Okay, time's up and I need to get on my next patient. No, she was giving me the 20 minutes that I had scheduled. So that's another. So first appointment, ask for a longer appointment time. When you get to the appointment and the medical assistant is checking you in, doing all the blood pressure and blood pressure checks and weight and maybe doing some lab testing, some back office lab testing. And usually they'll ask if there's anything specific and tell the medical assistant, say, yes, I have some specific questions. Would you like me to ask them of you now so that we can, so that the doctor can know in advance? Or do you want me to ask the doctor when they come in? And, depending on the way it works in that provider's office, they might want to, the medical assistant may want to be able to take the questions out to the provider so they'll be prepared to answer them when they come in. But just knowing that you have some questions, frequently the provider will walk into the office and say, hey, I hear you have some questions. And they'll either say, let's get those out of the way right away, or they say, here's my agenda, let's get this stuff done, and then we're going to come to your questions after that. If they don't, of course, say, hey, before we get started, I have a few questions, and it's really important to me that we get those addressed today. Do you want me to do that now, or do you want me to do that toward the end of the appointment? So again, it's collaborative, it's respectfully asking when is the appropriate time to address those questions. Um, and along with that, don't wait to announce that you have some questions until they're walking out the door. They come in and they stand, they come in, do all their stuff, stand up and start to walk out the door. Don't say, wait, I have a question. The second they walk in, make sure they know you have a question. Now, if they're standing up and walking out the door and you've already told them you have questions and they haven't addressed the questions, it's absolutely okay to say, hang on, I told you I had some questions. We really need to address these questions. Hopefully they won't do that. And I'm hoping, especially if you've done the prior three things, you've booked that first appointment, scheduled a longer time, told the medical assistant, told them that you've got some questions coming. Hopefully they're not going to just book out without asking your question, allowing you the time for your questions. So when it comes time to ask the questions or to present the thing that you're interested in changing in your treatment plan, make sure you're really organized. If somebody comes in and says, I've got something I want to talk about, and then they say, well, I heard about this one drug and what's it called? Um, God, the one that they advertise where the guy's playing golf, and that's not very helpful to me as a provider. My answer is, mm, you know, I'm running behind and you didn't spend a lot of time preparing it and I want to help you, but you got to be more organized. So write your questions down. If there's a medication that you want to ask about, if there's some lifestyle changes you want to ask about, if there's some lab values you're concerned about, have a list and write it down and write exactly the question that you want to ask and maybe some follow-ups. Say, whatever the thing is that you want to talk about, get it written down so when it's time to ask, you can ask the actual question that you had prepared ahead of time. And along with that, it's really helpful to have resources to provide if the provider wants to know more information. So if you learned something off the American Diabetes Association website, for instance, they just recently changed the dietary guidelines, the dietary recommendations. A lot of medical providers are still recommending the old American Diabetes Association guidelines that are pretty high carb. If you say, you know what, I don't want to do a high carb diet, I want to do a Mediterranean diet or a keto diet or whatever kind of diet that you want to try, one of the ones we talked about last week, and your doctor says, well, but this is how we've always done it. It would be really helpful if you can say, but the American Diabetes Association changed the guidelines here. Would you like to see what they have to say? And you can hand them the quick little sheet that has, because American Diabetes Association did a press release on that. It's quick to find on the website. So know what you want to talk about, have some backup information, and make sure that that backup information comes from legitimate sites that your medical provider is going to respect. So when somebody says to me, hey, have you heard about this herb? And I read about it on, some exercise weight loss bodybuilder site, and I've heard that it's going to cure my diabetes. My answer to that is, where's the science? I don't know. You know, the first question I want to know is what's actually in this thing, because I want to make sure it's not going to be harmful to the person. Whatever it is, it's probably not been studied. And if it has, then I should be able to find some information about it in a legitimate scientific site. So, journal articles are a really good place for that. The American Diabetes Association, even places like the Mayo Clinic, WebMD. There's a lot of legitimate medical sites that are accessible to people that are not medical providers. And if you want to talk to your provider about making a big change in your care plan, having sites that they can look at and say, oh, this, you've done some research. This is a legitimate recommendation. Yeah, let's try this. That makes sense to me. So, as far as diabetes goes, there's the American Diabetes Association. There's the American College of Endocrinologists. There's diabetes educators. There's two, and I can't remember off the top of my head, but there's two endocrinology associations that have different medication pathways that are very similar. But there's a lot of things that, particularly primary care providers, because they don't spend all the time doing diabetes education. They're doing all sorts of education. They know a lot of things. They go to antibiotic education, they go to women's health education. They don't have time to go to every single new conference that comes along about the latest diabetes drug. If you have the information that it's coming out, that these major organizations who set the pathways are recommending that this is a treatment, that's something legitimate that they might listen to. Um, so those are some strategies to get your provider to actually listen to the things that you have to say. And again, it's all about being polite. It's about asking for collaboration. And I do want to encourage you that if your provider is not somebody who gives you the respect that you deserve when you're looking at treating your own body, this is, you know, at the end of the day, when my patient is standing in front of me, I recognize that I might be the expert in the medicine that we're talking about, but they are the expert in their body. And I might have medical recommendations for them, but they are the one that is going to live the rest of their life in their body. And if you are standing in front of a provider who does not give you that same respect, it might be time to look for a different provider if you're not able to come up with a collaborative relationship with your provider. And that's a really difficult choice to make, and I will tell you that I have made that choice 3 times in my diabetes journey, where I realized that one, my first doctor, as I've said, didn't really respect me. And then a few endocrinologists, I had issues with them, not believing me and not respecting me. And then I had other doctors who were were really great, and they respected me, but they didn't have the knowledge to take me further, and they weren't willing to get the knowledge to take me further, and they weren't willing to learn from the resources that I was finding, and they weren't willing to change my treatment plan with that. So I had to continue looking until I found some providers and some specialists that I could really collaborate with. So I think it's important to be an advocate for yourself, not just in the world in general, but when you're in the medical office. And it is absolutely okay. And I don't know, I have to give you permission, but a lot of people definitely feel like, you know what, I'm so scared of the doctor because they're experts and they know everything. Well, first of all, we don't know everything. We don't know you. We don't know what's happening in your body. You are the one who knows that. You are the one that has to live for the rest of your life with whatever decision is made. So you need to be included and be part of the decisions that are made. So I will say these are hard. That is a hard thing to do. And this, what I just went through, can be a really hard thing to learn how to do. And I'm just going to quickly say, yesterday I introduced the mentoring program, and one of the topics that I cover in the mentoring program is how to establish a good relationship with your medical provider. And if you don't have a good relationship, and if you don't have a provider that you feel like you can have a good relationship with, how to find one, because that is so essential to your ongoing health. So again, I'll put the link in the description of today's video. If you'd like to have a discovery call with me to learn a little bit more about the mentoring program, I would love to talk with you about that. I've opened a few spots for that, and this is one of the things that I can help people kind of role play and figure out how to have conversations if there's things that they want to change about their treatment plan, if there's ways that they want to have better communication with their medical providers. Um, I will be back here tomorrow at 2:30. And I will be cooking again because I do not have a conference this weekend. So I'm really excited to be cooking again tomorrow. And I don't know yet what I'll be cooking, but it'll be a surprise. And we'll see you tomorrow at 2:30 Pacific right here. Bye.